First, we call for help, right? And then we administer 1 dose.
Tiana Vasquez is teaching a workshop on how to administer naloxone.
We place it into the nose, and then we do 1 firm push. You're gonna hear the click, it'll dispense, wait a sec, and then we take it out.
She's the education specialist for a program called Revive. It's run through the Virginia Department of Behavioral Health and Developmental Services.
Revive is meant to educate those on what an opioid overdose looks like, how to use naloxone, how to administer it, and also education behind overdoses itself, specifically opioids, but my goal personally is to help break the stigma.
Vasquez says the more we talk about opioids, the better equipped we are to handle their potentially deadly impacts. Revive is part of a statewide educational effort to address record-high opioid overdose deaths. In 2021, 2,229 Virginians died from opiates like fentanyl, heroin, and counterfeit prescription drugs.
It's more than just Revive, right? It's more than just opioid overdose education. It's building conversations, it's building relationships.
Vasquez says she and her team of more than 800 trainers have reached thousands of Virginians at workshops like this across the state, and their efforts may be paying off. The Virginia Department of Health released preliminary numbers for the first half of the year, showing a 30% decrease in opioid overdose deaths since 2021. Christopher Holstedge directs UVA Health's Blue Ridge Poison Center.
We're seeing a slight drop from the emergency departments too now, is hopeful.
Holstedge says a combination of prevention efforts are having an impact.
The federal government's been working on this, state governments have been working on this, the DEA has been working night and day on this. The health department has been in regards to prevention efforts. There's great people doing work with Revive training for naloxone out there. And so there's a whole host of efforts that have been done. And then it's a question of which ones do we think are the most effective right now.
He warns it's important to be cautious about administering naloxone and recommends it only be used when a person isn't breathing.
But if they're breathing fine, please be careful on that because you may actually do harm. You're going to find someone really combative, or you may put them into withdrawal, which is a really miserable experience for those patients.
And Vasquez says administering naloxone is just one part of addressing opioid use.
We teach, hey, you can save a life, but now what, right? So what's important to get away with Revive is that it's not a one-stop shop. We have to keep searching for more help after that.
Adrienne Hoar McGibbon, VPM News. Thank you for watching. Make sure to subscribe to the VPM YouTube channel, hit the bell for notifications, and visit vpm.org for more in-depth coverage.